Everyone knows you need to brush and floss your kids' teeth while they're young, but at what age should they begin visiting a dentist?
At what age do you think you should take your kid to the dentist for the first time?
Probably 6 or 7.
Well, I've actually heard a couple of different ideas on that. Some say 2, some say 3, some say as old as 5. I took my kids about the age of 4.
Probably when they're 2.
What age do you think someone should take their kid to the dentist for the first time?
Probably 3 or 4. I like to stretch it to 5. Not as expensive.
I think as soon as they start cutting teeth.
Well, Dr. David Stewart from Little People's Dental has the right answer to the question, what age should a child start visiting the dentist?
That's a question we get all the time, and people hear lots of different things, Darren. Really, a child becomes at risk for decay as soon as teeth come in. And so really, that's the time when we should start thinking about those teeth and how to prevent decay in those teeth. And so the guideline is 1 year, first tooth, or 12 months of age, whichever comes first. And that is because as soon as those teeth are in, they're at risk for decay.
But are they really, is there really a risk for decay there? I mean, they're a year old, they're really not eating like candy bars like the rest of us, unless like Brooke, where her parents had a shave ice machine or something. Are they really gonna be at risk for decay then?
And I'll get that question, what are the risks? I have seen a child at 18 months have teeth decayed to the gum line. And so as soon as teeth come in, if a child has the right diet, if they're not getting the right oral hygiene and they have high risk, they can immediately start getting decay in those teeth. And so at that transition age when teeth come in too, that's when they're setting up their diet for the rest of their life. We're setting up oral hygiene for habits within a family. And so that's why that's a crucial time, because now they're in the mouth and parents often don't know what to do next. Well, what do I do with these teeth that are there?
I know there are some warning signs. We're gonna get to those in a second. First, I gotta ask you, if a mother is at risk and has a higher decay factor, does the child also have that increased factor?
Definitely. In fact, we know decay is not necessarily a genetic disease. People often say, well, my grandma had bad teeth, I have bad teeth, my children are gonna have bad teeth. It's a bacterial infection that we pass on, really. And so if the mom has the right bacteria for decay, then she can transfer that bacteria to her child when those teeth are just erupting in. And so that's why as soon as those teeth are coming in, we want to see that child and assess that risk. In a mother that actually has high decay rate, the recommendation is that she have her child seen before they have teeth, because we want to nip that in the bud. We'd really ideally not like to transfer that bacteria in mom's mouth to the child's mouth. And there's some things that can be done to reduce that child's risk of getting mom's bacteria.
Fascinating that you need to actually see them before they even have the teeth coming through. You have some other risk factors we need to watch for. We'll go through some of the list there. What are some other factors to watch?
You know, kids, just their life is a risk factor. I mean, just what they do, you know, just their habits and things. But some really big ones, special health care needs, children that are difficult to get into their mouth anyway. You know, children who sleep with the bottle at night or on the breast at night, breastfeeding all night long. Later order offspring, which is really kids that are born later, you know, and there are more kids in the family. Children who snack frequently, which most children do if we don't teach them correct habits. And then obvious caries or just plaque and stains, things that are not getting off the teeth. All of those things put a child really at risk.
Is a kid going to cooperate for something like this? I mean, you take the kid in, and the dentist is probing around. What is the kid going to do?
Well, a lot of times mothers ask me, they say, my child's not going to get in the chair. How are you going to do this? Or my child's going to cry. And we expect that. Most 1-year-olds will cry. That's how they communicate. And so as we do these exams, we'll do a knee-to-knee exam where a child's sitting in mom's lap, laying back into the doctor's lap. And we'll look first and check her wrists or his wrists. As they get older, I find that usually if they've started young, within just a few visits, they're then into the chair. So actually, we're not creating negative experience for kids. We're getting them used to the dentist, and we're actually seeing them in the chair sooner than if we start them later on too.
Not only are the kids being trained, you actually try to train the parents to do some things as well.
And you know, that really, in these early infant exams, is the take-home message, is that as I see a child at 1 year or first teeth, I'm hopeful and expecting not to see decay. My goal as I see that mother and that child and parent is we assess that child's risk, and then I teach that parent what to do so that child never gets decay. And so this early infant exam recommendation, a lot of people say, what do you do with those, or why do you do them? The goal is prevention. The decay is about 90% preventable. Most kids don't have to get decay if we start the right things early. And so in these exams, we sit down, we assess risks, we make a specific plan for the child, and then we teach that parent or grandparent or whoever that primary care provider how to brush and floss and what kind of diet and how to help this child to never never have those risk factors that will lead them to have decay.
How does a parent find a dentist like that who will do that kind of stuff?
You know, I think as you look, you need to specifically ask the office as you call. Do you do early infant exams? Do you teach prevention? Will you show me how to brush and floss this child's teeth? Are you comfortable seeing a 1-year-old, or are your doctors? Because a lot of times you're not talking to the doctor, you're talking to the front desk. And honestly, there are some offices that do that and some that don't. There are some offices that don't want to teach that, and that's okay. Yeah, and that's okay. You know, just like you have obstetricians that don't see children, you have the general dentist office that want to see children or not. Pediatric offices, pediatric dental offices should. There are many general dentist offices that do a fabulous job with early infant exams. So it's really looking and knowing that you should, as you go to an exam, be getting taught how to brush your children's teeth. You know, they should be putting fluoride on those teeth, showing you how to get in, and really careful in assessing risk.
Of course, it's all stuff they do at Little People's Dental. And if you want more information, you can get, of course, get in touch with them. Their website, littlepeoplesdental.com. They got great pediatric dental care. So if you've got kids and you want to focus on that, that's the place to go. Thanks so much for letting us know about it.
Thank you.